The Women's Health Initiative study was a really important study, actually. It was the largest study of its kind. It cost, millions and millions of dollars to do this study, but the purpose of it was to show, the authors of the study thought they were going to show the benefits of hormone replacement therapy for most women, right? They really figured they were going to see all advantages and nothing bad. When the Women's Health Initiative study results came out, they were surprised because there were some adverse events that they weren't expecting. So there was a small increase in breast cancer. There was a small increase in the risk of heart attack and stroke. So the study was stopped prematurely. But when the data was broken down, there were definitely issues with the study. So for one thing, on average, women in the study were 63 years old. Well, if you think that most women go through menopause in their early 50s, that's a long way out from their menopause, being 63. That's the average age of women in the study. Women in the study were not suffering from any symptoms of hot flashes at all. And also, they were using conjugated estrogen in the study, and they were also using a synthetic progestin. So things that are not considered natural bioidentical hormones, right? So there were definitely some flaws with the Women's Health Initiative. So unfortunately, when the results came out, they were plastered all over the newspaper. It was all doom and gloom, and women really stopped their hormones at that point. Doctors got really scared, and the whole thing was painted kind of black, that it was all bad. But the details hadn't been really looked at yet. So as the story evolved, we found out what the flaws in the study were, and nowadays, women are offered different hormones. They're offered them closer to their menopause, and it's done a lot differently without these large standard doses of synthetic hormones that women were given. Now we would give smaller doses of bioidentical hormones and closer monitoring. So remember that women in the study were on average 63. Okay, so we think and basically know that estrogen is protective for heart disease. So women have less issues in terms of heart attack and stroke before their menopause. Once menopause hits and we lose our estrogen, estrogen seems to help keep our vessels clean of plaque. So once we lose estrogen, that plaque starts to develop, and you get vessels that have more plaque, more narrowing. And all of a sudden, if you give an oral estrogen, and we're talking oral estrogen because the studies don't show the same with transdermal estrogen, but if you give an oral estrogen in that older demographic, then that atherosclerotic plaque, that can rupture, that can break off, and you can end up with a heart attack or a stroke. So that's really the issue. First of all, we should know that women, there was a couple different arms to this study. Some women received estrogen alone, and some received estrogen and progestin alone. The estrogen-only arm, they did not have an increased risk of breast cancer at all. It was the estrogen and progestin arm that did, and it was also a very small amount of increased risk. Like, there was an extra 8 per 10,000 women, I think was the exact data that had that increased breast cancer. So it was very small, but still considered significant. But it seemed to be basically the synthetic progestin that was really the issue, not the estrogen alone. Certainly the positives would be the things you'd expect. Women, of course, would have hot flash resolution if they had any hot flashes. But remember I did say that most women in the study were hot flash free to begin with. Of course, they had positive effect on bones. So it really affected the bones and osteoporosis risk in a beneficial way. Oral estrogens together, whether they're synthetic or they're bioidentical, they do have some problematic risks. So they can increase your clotting risk. Once estrogen goes through the stomach and the liver, it increases clotting factors. So there is more risk of stroke, especially, and this is very important, it's usually within the first 2 years of starting oral estrogen. After that 2-year window, The risk of a stroke decreases actually. I shouldn't say decreases, it does not increase. Bioidentical progesterone has really no risk in terms of heart attacks, stroke. I don't think there's any risk in terms of breast cancer either. And orally, bioidentical progesterone is very nice. It doesn't really have any adverse effects. Synthetic progestin absolutely will affect mood in a negative way. It affects triglycerides, will increase triglycerides, which are a lipid in the blood. Oral progesterone doesn't. It seems to calm the body down, helps women with sleep, irritability, mood, protects the endometrium, protects the breast as well from estrogen proliferation. That's a really good question. What they've found is, if the synthetic hormones are used in small doses for short periods of time, the side effects maybe aren't quite so bad. But if they're used in larger doses, long periods of time, there's definitely a risk. So I'd like to see them not used because there are so many better options. There is the ELITE trial, which is ongoing right now. The KEEP study came out in October 2012, those results, and it was just a 4-year study and looked at the risk of using bioidentical hormones early on in the menopause. So women were 51 in that study, and the results over 4 years were quite good. There was no increased risk of breast cancer, no increased risk of heart attacks or stroke in the group, and they were using a transdermal bioidentical estrogen and bioidentical progesterone in that study. But the ELITE trial, it's still being conducted.